Hi, Dr. Lavan here. So I thought we'd talk about a condition today that commonly affects a lot of us, but I think really doesn't get the attention it deserves. That's epistaxis, or nosebleeds. So I've had 3 calls this week at the clinic regarding nosebleeds, and I actually had to bring one of them in to burn. I'll tell you a little bit more about that at the end of this video. So the concern about nosebleeds is actually the vast amount of blood that actually appears, if you think about it, from a relatively small point, and that unfortunately causes quite a lot of anxiety, and this can actually cause large amounts of bleeding to occur. I've actually seen cases where patients have actually collapsed as a result of this. So it's really important we can manage this condition a lot better, because it is actually a vicious cycle that can go round and round, make your anxiety worse and actually cause more bleeding. I would really like to make sure that by the end of this video, those of you who do sadly suffer from nosebleeds, or maybe have a family member who does, we can use this video to better manage our patients with nosebleeds and hopefully avoid the need to go into hospital to have it sorted out. If you have a liver problem or any condition where it might involve you have blood thinners, or you suffer from a blood disorder, so things like anemia, or even suffer from blood pressure, please remember that you do need to have a lower threshold for contacting the emergency services, because sadly in these cases the deterioration of the bleeding can be much more rapid. So we get some ice and we place it in a towel, and we place it firstly at the back of the neck and the side of the neck, and also on the forehead. We can then also allow them to take an ice lolly, sometimes even take an ice cube, but do that very carefully. We'll need to apply pressure to both nostrils, so we normally tell patients to lean their head forward, and we apply pressure on both the nostrils as hard as possible to ensure that the bleeding can stop. So we want to ensure that the patient is actually leaning forward when we apply the pressure on the nose. Traditionally, many of the patients used to lift their heads back, and they also used to grab at the bridge of the nose, but what we found is that was absolutely a waste of time, and in fact the blood would seep into the back of the throat and make them want to gag or vomit. So remember to do the manoeuvre properly, head forward and apply pressure at the tip of the nose. So if the bleed is controlled, we really want to make sure it doesn't come back again, and there are a few techniques we can use. If you're at home, something simple like Vaseline applied to that area can really help in avoiding this from coming back. As ENT doctors, we actually use a lovely product known as Nosebleed. Now this has an antibacterial property as well as a way of sealing the area of bleed, and used 4 times a day for up to 2 weeks can really help in stopping the bleed from reoccurring again. If you are unable to control these by these simple methods I've told you to use at home, you may have to come and see one of us. Obviously, if there are some risk factors, things like high blood pressure, we do want to be cautious and say you do need to attend A&E to get this sorted out. However, when you do come and see me, we do something here called cauterization or burn. That's simply a stick with a little bit of silver nitrate, and the wonderful thing about this is when we apply it to these areas, it can actually seal and burn the areas. By doing this, we can actually avoid the bleed from coming and actually stop it in its tracks. The problem with bleeding and the problem with applying silver nitrate is it can be quite sore. So therefore we sometimes apply a very local anaesthetic onto the area in the form of a spray or gel, which just reduces the soreness. The area we target is called Little's area, described in 1879 by James L. Little, an American surgeon who described the area. Basically, it's where the blood vessels meet, and by applying it to a few points around this area, you can burn around the point and finally end with the main blood point itself. So there we go. I hope you found this video useful. So please like, subscribe and do comment on the video, and I hope you all stay well.